Today's hearing, it's not about health care, and it's not about protecting women or their children. Today's hearing is about weaponizing a radical, pro-abortion agenda against states that seek to protect women and the unborn. When two healthy people enter a doctor's office and only one comes out, that's not health care. When Roe versus Wade was decided, the scientific consensus was that a baby had to be 24 weeks old to experience pain. However, we know that this is not true, that babies can feel pain as early as 12 weeks. Unfortunately, this is why the U.S. is only one of the very few countries that allow elective abortion past 20 weeks after life begins. Dr. Scott, modern-day science and research have changed our knowledge on the true point of viability. Do you believe the laws surrounding viability should be updated as well?
Absolutely. I think we need to acknowledge the science that we have experienced since Roe and amend our abortion legislation accordingly.
Okay, thank you. And also, we've heard that in today's hearing that abortions have gotten safer over the years. I can't imagine how that's possible when the baby doesn't come out of the procedure. But when we're talking about the procedure having gotten safer over the years, is that true, that it's gotten safer for the mother?
It has gotten safer. Along the way, our surgical skills have improved, our anesthetic skills have improved, antibiotic. We just have evidence-based medicine that's more advanced than it was back at the time of Roe. But it should be noted that although it's commonly stated that 5,000 to 10,000 women died from septic abortions yearly before Roe, that number is not reflected in any of the medical literature at that time. The American Medical Association, the CDC document one or a couple hundred deaths, which is still way too many, but it was not as dangerous even prior to Roe, but that was just used as a talking point in order to get the procedure legalized.
Can you explain if there are any physical risks associated with chemical abortions?
The biggest immediate risk is not passing the tissue completely, having a hemorrhage, requiring a surgery. There was a large study, a Chinese study, I believe, that looked at women who had medical abortions, who failed, who needed surgery, and in that small group, they found a 361% increased risk of preterm birth and a subsequent pregnancy. So the worst scenario is to do both, to have a medical abortion that fails and then to have a surgery as well. Additionally, rat studies have shown us that independent of what the rat thinks about the abortion, mifepristone increases the rat behaviors that are reflective of anxiety and depression. Many of the deaths that have occurred after mifepristone have been from an unusual type of sepsis from an organism called Clostridium sordelli. Both misoprostol and mifepristone impair the immune system of a woman and so put them at higher risk of infections.
If I can just ask another question. On top of the serious physical risks associated with medical abortions, we know that the process is long and can be emotionally traumatizing for expecting mothers. Can you speak on the emotional impact this process can have on mothers?
Sure. One thing that's not really discussed is that an 8-week fetus is about the size and shape of a gummy bear. It's clearly human. You can see arms, you can see legs, and you can see a head. And women are passing those in their toilet, and they're seeing their unborn baby. So they're not going to tell anybody that they saw that, but can you imagine the emotional trauma of seeing your own child?
No, I can't imagine that. And I think it's clear now more than ever that every life is precious and worth protecting. I would just urge my colleagues to stand for life. Thank you, and I yield back.